First Responders Peer Support Team Review. My name is Steven Sacatello. I have 15 years of first responding experience, 10 of which as a professional firefighter. I've completed my honors BA in physical education kinesiology from Wilfrid University. I'm in progress of my honors BA psychology from Ryerson. As a peer support coordinator for the past 4 years at my department, I worked with 8 other peers and organized a department of 250 plus members. Over my 10 years, I interviewed hundreds of firefighters and collected a significant amount of qualitative data. Post-traumatic stress disorder, or PTSD, is an anxiety disorder of stress arousal, symptoms lasting 30 days or more, producing significant disruption to activities of daily living. 1 in 10 Canadians over the age of 18 will meet the criteria of PTSD. First responders are twice as likely to develop PTSD than the average Canadian. Given this, Bill 163 was established in 2016. PTSD was approved as a work-related injury. To meet and address the mental health needs of first responders, the government outlined criteria in legislation. First responding departments activated volunteer peer support teams. Since 2016, departments met criteria outlined in legislation. However, PTSD and suicides have continued to rise annually. Why? In order to evaluate the why, we have to evaluate the current peer support team systems model. The pro of the model provides mitigation to those peers who are willing and wanting help. The con is it does not provide mitigation for those who need but are not verbally asking or wanting help. This is called suffering in silence, aka stigma. As you can see, this is the present peer support team model, and it flows for all those willing and wanting to get help. But for those needing help but not wanting it, they can hide behind this wall of stigma. As such, the chance for intervention are greatly reduced, and so is the chance of recovery. In order to further address the why, we need to reframe the way we evaluate our system model to incorporate traumatic events. We need to address the amount and significance of traumatic occurrences in a first responder's career. Trauma is a psychic injury resulting from emotional shock. If PTSD is the knockout, trauma is the jab. Identifying traumatic events. A traumatic event can be witnessing death. Traumatic event could be near-death experience, own or someone else's. A traumatic event could be a workplace culture, i.e. bullying. These traumatic events hurt us if they were unexpected, if the person was unprepared, or if there's nothing the person could do to prevent it from happening. The signs of too much trauma. Please make note of these. Using alcohol and drugs to cope. Withdrawing from social activities. Withdrawing from family or friends. Change in work attendance. WAGNER et al. 2019 found empathy significantly associated with increased levels of PTSD and other mental health symptomologies in fire. Given WAGNER's findings, the SACFAT looks to use empathy along with the signs of too much trauma, which include a decrease in social life, a decrease in friends and family, and a change in work attendance, all to identify and evaluate the severity trauma and traumatic events have on a first responder. Along with 6 other departments, 300 peers, design a new system model that includes the SACFAT, a model that will not only mitigate those who are willing and wanting help, but also identify those who may not know they need help or want help. Identify those who are behind the wall of stigma and reduce the chance of PTSD and suicide. Reducing the stigma in first responding is the socially responsible thing to do. Thank you.
This is my analysis of the home care sector in Ontario. My name is Jenny. I'm currently a Master's of Arts student at Ryerson University. I'm both a student and a professional. I've worked at the Ministry of Health for about 3 years. I have a strong interest in home and healthcare policy. I believe that effective policy requires a complete understanding of the system you're trying to change, and I think home care is going to be a central part of the healthcare system in the future. This is my home care systems map. As we can tell, the PSWs, so personal support workers and also patients, right here, are really at the heart of the system. In Ontario, home care services support people with health issues who are unable to care for themselves but can remain at home if they have the proper support, such as nursing, personal support, physiotherapy, social work, and other types of care services. In 2012, over 2.2 million Canadians received home care through either publicly funded sources or private sources. The need for home care can be caused by long-term health conditions, disability, or age-related health issues. Home care is not driven only by the needs of the aging population, but also by advances in medical technology that now allow for more medical procedures to be conducted in a home setting. As the population ages in Ontario, there's more demand for home care services for the elderly, particularly those living with chronic medical conditions. Hospitals are constantly overcrowded, and advocates for home care argue that this sector could reduce pressure on hospitals. Patients have embraced these changes for their convenience and comfort. Governments have welcomed this shift to home care due to its lower costs. Although home care is publicly funded for patients in Ontario, all frontline care has been outsourced to a variety of external organizations ranging from large nonprofit organizations to for-profit companies. Patients and families with the financial means who are able to afford it can pay out of pocket for additional home care services. In addition, as the population in Ontario ages, the demographics of the average home care patient has changed. The average age is now over age of 75, and the prevalence of dementia has increased to over a quarter of patients. Home care patients are less able to perform ordinary day-to-day tasks in personal hygiene, toilet use, locomotion, and eating, therefore becoming more reliant on their caregivers and healthcare providers. Home care has many problems. It has been criticized as being hard to understand, having a lack of care standards, and being not transparent for patients and families. With demand increasing as baby boomers age while funding has not increased at the same levels, government agencies have had to modify assessment criteria and reduce hours and services. Although Ontario spent double the Canadian average on home care, the sector only received 5% of the 2018 to 2019 budget. Wages in home care are also 18% lower compared to hospitals, 9% lower compared to long-term care homes. There is a chronic shortage of personal support workers, or PSWs, across the healthcare system. Low wages make it difficult to recruit staff. These factors contribute to a heavy reliance on informal caregivers such as family, friends, and neighbors. With the high needs of our aging population, these caregivers become burned out from juggling caregiving obligations with every other aspect of their lives. A system that relies on informal caregiving is not sustainable, as caregivers are experiencing burnout and funding levels remain inadequate to meet rising demand, currently and in the future. In conclusion, we've learned that home care services allow an aging population to receive care in their homes, easing pressures from an already overburdened hospital system and presenting a lower cost alternative to hospital care or long-term care homes. Solutions to address the low pay and low autonomy characteristics of PSW roles can positively impact the entire healthcare system and the home care system in general, but by providing workers that are central to this sector. We also need to increase funding for home care services at a higher level and to bring funding up to the level required to maintain a sustainable system. Home care is a linchpin of Ontario's healthcare system, but it has not been treated or funded as such. With an aging population that will only demand more home care services going forward and who will strain the hospital system, we need to think about ways to quickly improve home care now. Thank you very much. This is my presentation.